Hey everyone, Dr. Adam here with St. Louis Thyroid Support. Hoping y'all are having a great week. I just wanted to make a quick video about a case that I just started working with. A very nice lady we just started working with, and she's got some of the typical things we hear about quite a bit as far as she's already been dealing with some thyroid problems, diagnosed with low thyroid function. But she still deals with the weight gain. She still deals with the chronic fatigue, brain fog, a lot of pain patterns as well, as far as joint pains, back pain, those types of things. So we're in the process of doing some workups with her with some additional functional testing and some extended testing. And I wanted to talk about a few of the things that we found just to kind of give you an idea of some of the kind of underlying things that could be happening with these types of situations and these types of symptoms. So one of the things that we found with her when we did an extended type of thyroid panel, and of course I've talked about some of this in some of my previous videos, but we did an extended thyroid panel, and what we found was she was dealing with a high reverse T3. Now, what that is, so your thyroid makes two hormones, T3 and T4. T3 is an active hormone, which means your body is what your body actually uses, what your cells use for all of the thyroid function. T4 is an inactive form of the hormone that has to be converted by your body into T3. So in order for your body to actually use it. So in a majority of what your body makes is the T4. So it has to do a lot of converting of that hormone. Now, what can happen is, because of other types of underlying metabolic stresses or other types of even emotional and physical types of stressors, high amounts of inflammation, things that can set off your body's stress response, your body will end up converting this T4 into what's called reverse T3, which is essentially a metabolite. It's just a little unusable hormone, basically. So you have a high amount of this reverse T3, and your body can't use it. So it's not able to be used by your cells. But what it will do is, even though it can't be used by your cells, the reverse T3 will still attach to your cells. So it'll block essentially the little doorway that your normal T3 should be able to attach to your cell to get inside the cell so your cell can actually use it. This reverse T3 will block those little doorways. So even though, and in this case this was true, this particular lady, her TSH, her thyroid stimulating hormone, and her T4 levels, which are the typical kind of gold standards as far as what most docs check when it comes to thyroid function, TSH and T4 were perfectly normal, but she was dealing with this high reverse T3. So we know something else is going on, and this high reverse T3, even though the TSH is normal, it can still produce thyroid symptoms because her hormones aren't getting used. They're not getting converted properly, and the T3 are not getting used. So she can still suffer from the thyroid symptoms, even though her thyroid itself is working okay, but there's problems coming up with overconversion of the reverse T3. So when we go back and we look at, once again, those extended panels, we saw other patterns as well. She was dealing with lots and lots of inflammation, okay? Systemic inflammation, her C-reactive protein, her homocysteine markers, some of her white blood cells, her ferritin markers were all elevated. So this indicates chronic immune system dysregulation and chronic inflammation. Her liver enzymes were also elevated and raised. So she's dealing with the inflammation plus some liver stress. And of course, the liver is where a lot of that conversion takes place. Her blood sugars were also very high. Her A1C was very high. So she's dealing with blood sugar dysregulation. So once you start taking a step back and trying to figure out some of these underlying problems, you have to look for these types of patterns, because at least now we know where some of these imbalances are coming from. We're still in the process of trying to calm down some of these things. We're going to be taking her through some dietary protocols and some nutrient protocols to help calm down the inflammation, to help calm down some of these stressors. Ideally, once we're able to do that, we're going to be able to get her conversion back to being normalized. You know, we're trying to prevent that high reverse T3 from happening over and over again by addressing, you know, some of these sources of stress, you know, whether it's the emotional stressors, chemical stresses, metabolic stressors, you know, which she's of course dealing with. So we're going to be addressing all of these factors, you know, trying to support, you know, her body more naturally and getting her body and her metabolism kind of back online to where her T3 hormones can actually get used by her body, you know, whether it's the ones she's making naturally or the ones she's taking with some of her medications as well. So it's always interesting, you know, once you really start to dig a little deeper into these types of problems, you can essentially figure out so much more about what a person really needs and why all these things were happening to begin with. You know, why was she taking these medications and yet none of these problems were changing? It's because the problem had nothing to do with her shortage of medication. It had everything to do with how her body was processing these thyroids and how her body and her immune system and the inflammation were all coming together and essentially creating this internal chaos. So that's what we're going to be focused on. That's what we're going to work on in order to get her healthier, to get her to be able to lose the weight she wants to get her energy back, to get her to where she can think straight. You know, that's the goal. So anyway, as always, if you have questions about these types of problems or reverse T3, as always, you can find more information on our stlouisthyroidsupport.com website, or just give us a call here at the office, 314-646-0013. Hope you'll learn something new today, and we'll talk to you real soon. Thanks.